Good evening, everyone. I'm Dr. Mayank Chansoria, and today I'll be discussing in very brief the basic diagnostic methodology of tachyarrhythmias. I want to make it very simple so that it is easier for everyone to understand. I'll not go into the basic details. It's a very short and concise um, discussion over how to read an ECG whenever you are suspecting some tachyarrhythmias. So let's start. Tachyarrhythmias is whenever you are appreciating on ECG, a 12 lead ECG, a heart rate more than 150, 160 per minute. So whenever the heart rate is more than 150 or 160 per minute, we take it as a tachycardia. Next, most important step is to see the width of the QRS complex. That is the most important part. So if the width is less than 0.12 seconds, then it is a narrow complex tachycardia. And if the width is more than 0.12 seconds, it is a wide complex tachycardia. This is the most important step. If you can differentiate between these two things, you will be able to taper down a lot of diagnosis. So if it is a narrow complex tachycardia, that is the width is less than 0.12 seconds, then you have to see whether the rhythm on eyeballing is regular or irregular. If the rhythm is regular, there are few very important tachycardias which you should easily it should come into your mind. So if it is a narrow complex tachycardia with a regular rhythm, important tachyarrhythmias you should think of is a sinus tachycardia, a paroxysmal supraventricular tachycardia, that is PSVT or SVT. You might have premature beats, or sometimes an atrial flutter also is taken into this category. But these are 3 or 4 very important diagnostic pathologies which should come into your mind. There are few complicated also, but I don't think so that is required in this discussion. If a narrow complex tachycardia is having an irregular rhythm, 2 or 3 very important things which should come into your mind is, first is atrial fibrillation, AFib. So narrow complex with irregular rhythm, obviously the P waves are absent. AF should come into your mind, atrial flutter should come into your mind, and MAT, that is multifocal atrial tachycardia, should come into your mind. So this is how you narrow down your diagnosis to a narrow complex, regular or irregular rhythm, and what are the probable diagnoses. Now the second part, the wide complex tachycardias, where the QRS complex is more than 0.12 seconds. Again, we'll see whether the rhythm is regular or irregular. So again, wide complex with regular rhythm, most important is monomorphic ventricular tachycardia, a plain VT, ventricular tachycardia. Secondly, a very important diagnosis is supraventricular tachycardia with any aberrancy. If you are having a pre-existing myocardial disease where the Purkinje system and bundle of His are involved, or there is any infarct or fibrous tissue, or there are any electrolyte imbalances due to any metabolic problems, then you may have a wide complex tachycardia with a regular rhythm, which is actually SVT with aberrancy. Again, if a wide complex tachycardia is having an irregular rhythm, you might have to again go back to that aberrancy, that is AF, which is a narrow complex irregular with aberrancy. polymorphic ventricular tachycardia. Polymorphic ventricular tachycardia is something where the shape and size of every complex is different. Monomorphic ventricular tachycardia, where every shape and size of complex was same, comes into regular rhythm, and polymorphic comes into irregular rhythm. So AF with aberrancy, polymorphic ventricular tachycardia, and torsade pointis. This is what comes into a wide complex tachycardia with an irregular rhythm. So this is how you differentiate and narrow down your diagnosis of tachyarrhythmias. Next time we'll discuss the treatment part according to AHA guidelines. Thank you.